your questions and provide some really great background so we have better information, make decisions. Before we get started, I want to thank Miller Lumber and Sunwest Builders. They're the ones who make these webinars free to everybody, and we're very grateful to them for helping us out with that. So Michael Wood is the administrator for Osha, and I think that it's really important for all of us today to hear what regulations are coming into play. And the purpose of this is, how do I, as an employer, understand what to do with these regulations? What's my responsibility? And I know I've already heard from many, many members that there are some questions that just need some clarification. So the way it's going to go today is there's a Q&A box at the end. That's where you put your questions, and we will be monitoring those as we go. Michael's going to share with us a quick presentation and overview of where we're at right now in the state as far as employers requiring things for their employees and their customers. And then we'll get to your Q&A there at the end. And again, we're really grateful to you, Michael, for joining us today. I'm going to go ahead and let you take it away.
So I appreciate the opportunity. I'm looking at my photo quality, which is never great because it's always a photo of me, but at the moment is even more washed out than usual in my sort of ad hoc studio here. But I'm sure you will be able to hear what I have to say. And I do have a document, if I can share it. Let's see. I think somebody needs to give me the ability to share. There we go, I think. So are you able to see that PowerPoint?
Looks good.
Okay. So I want to go through just really quickly the underlying rule, which of course, 2.5 weeks ago, the big news was that we were moving forward with what was described as a permanent rule. The discussions around facial coverings and vaccines have pretty well eclipsed that, but I think this will provide a helpful context, so I'll try to go through it quickly. So we did adopt a rule on May 4th. It extends the worker protections against COVID-19, specifically in relation to the pandemic in Oregon workplaces. It was limited to that at the recommendation of both our rulemaking advisory committees. We had considered a broader infectious disease rule, and for various reasons, all the members of the advisory committees told us to, at the very least, hold off on that. It is largely, although not entirely, identical to the temporary rule that was already in effect. That means it's based on requirements from the Oregon Health Authority, as well as recommendations from the Centers for Disease Control, and it will be repealed when it's not needed to address the COVID-19 pandemic in Oregon workplaces. I want to spend a little bit of time on the process for repealing the rule because that's probably what got the most conversation. So the law actually talks about permanent rules and temporary rules. The law talks about rules and a process to adopt temporary rules that doesn't need to follow the requirements of the Administrative Procedures Act. So after we adopted that temporary rule, we had 180 days that it could be in effect, and then we couldn't use the process to renew it or extend it. So we had to go through the full rulemaking process, what unfortunately we described and allowed to be described as the permanent rulemaking process, which caused some people to, my favorite comment is actually the one that says that 10 years from now, people are going to look at this masking and social distancing requirement and wonder what idiot adopted that. It's not going to be in place 10 years from now, I assure you of that. Certain requirements actually adjust automatically, those related to facial coverings. If the Oregon Health Authority updates its guidance, for example, they automatically adjust, and that is related to the vaccination conversation. We also can make adjustments addressing many issues using interpretive and enforcement policy. Some elements of the vaccination exemption are a current example of that. Even if COVID-19 does not entirely go away, as indeed it is likely to linger with us in some fashion, the rule will be repealed. The rule is about addressing the COVID-19 pandemic, not simply addressing COVID-19. And in deciding when to repeal the rule, we will engage with our stakeholders. We'll talk about infection rates, vaccination levels, spreads of variant strains, hospitalization and death data, among other things. The real issue for the rule was we couldn't identify a particular date because we didn't know what it was. And we couldn't identify a particular indicator because there are a number of indicators and they relate to one another in ways that we're not even clear on at this point. Some people said, when I give that answer, they'd say, well, you're saying it's too complicated for us to understand. And really the answer is it's too complicated for me to answer in advance. And that is the struggle. Otherwise, I would have been happy to put some sort of trigger that would automatically repeal the rule because, frankly, that's easier for us from an administrative standpoint. This describes the key components of the rule, and the bold-faced highlighting indicates those things that basically are triggered by other activities. It still addresses physical distancing. It addresses facial coverings in line with OHA guidance. It addresses cleaning and sanitation, but those requirements are actually scaled way back from what was in the temporary rule. It has ventilation, including an attestation by employers that they're complying. That doesn't require a certification by a ventilation engineer or anything like that. It's simply a declaration on the part of the employer. It does include the exposure risk assessment, but that should already be done as part of the temporary rule. It doesn't need to be done again. And the same thing is true of the infection control plan and training. It still requires employee exposure notifications, and those are triggered by the cases, and that was true in the temporary rule. It requires cooperation with testing, but it's unlikely the Oregon Health Authority is going to make use of that provision any longer. And does require medical removal. That guidance adjusts automatically when the direction that OHA provides related to quarantine and how long to quarantine and the nature of the quarantine is changed. So, for example, there has been information added to that related to vaccinations, and that the rule takes that into account without actually changing the rule. There are some other changes for healthcare and some of the other exceptional risk employers. And then there still are appendices with some information for specific industries. Those are 50 pages shorter than they were in the temporary rule. Actually, they're more than 50 pages shorter because a lot of them are a third of a page or a half page long now. And really, they just focus on worker protection issues. And for the most part, they provide effectively exemptions that explain how you don't need to fully meet something that is a requirement of the general rule. In summary, the rule will not be in place permanently, but it does recognize the reality that the need to protect workers against COVID-19 has not yet passed. We work very hard to try to balance those worker protection needs with the legitimate needs of employers, some of whom have been hit very hard by this pandemic, and we're very conscious of that. We followed Oregon Health Authority and CDC guidance, and we took specific concerns about the proposal very seriously. If followed, we believe it will increase the protection of individual workers, and we also believe it will reduce the risk of workplaces becoming the source of further infection. And so that leads me to talk about face coverings and vaccination. And for that conversation, I'll just go ahead and quit sharing. So stop share. There we go. So in relation to the facial covering requirements, the CDC frankly caught all of us by surprise. And I know I've heard the same complaints from national business organizations and national labor organizations. And when they put out their guidance for vaccinated individuals last week, it didn't seem that they really thought about the implications of that guidance in relation to how businesses would handle it. And so it really created two sets of requirements, one for vaccinated people, or two sets of recommendations really from the CDC, one for vaccinated people and one for unvaccinated people. It makes sense to follow those requirements, and so that's why the Oregon Health Authority has decided to do that. But then it raises the question about how you know whether you're dealing with someone who is vaccinated and unvaccinated. And really, at that point, the state and whatever the state does, individual employers end up with two options. You can either simply trust that someone who comes into the establishment without a mask is in fact fully vaccinated, or you can ask for some sort of verification. And so Oregon Health Authority and the state really decided to go the route of saying that since fewer than half the state is vaccinated, right around half right now, certainly the working age population, it's lower than that. So we are asking businesses and employers to verify. Now, for employers, that's relatively easy to do in relation to their workers. It does become a more complicated challenge for public-facing businesses. And so, I mean, the first advice I have is you really need to have clear signage. Whatever you decide to do, clearly indicate it so that people are told as they're entering or before they enter clearly what's going to be expected of them. And then you really either need to say that you're going to continue to enforce facial covering or distancing, and distancing for everyone, or you need to say that if people come in without a facial covering, they will be expected to provide some verification of their vaccine status. And the easiest verification is the card that we all got when we were vaccinated. And so that is basically where we stand. I am sure that there are loads of questions about that, and I've tried to go through what I've said so far quickly, so that we can have time for questions. Can I suggest that before we get into the questions about the facial covering and the vaccination issue, that we make sure if anybody has questions about the underlying rule that they get those asked and resolved first, and then spend the remainder of the time on facial coverings and vaccinations. Does that work, Katie, or whoever is going to MC the questions?
Sure, I'm emceeing the questions, and as expected, a lot of folks, I think, Michael, there you go. A lot of folks have questions about the masking and vaccination protocol. I don't see anything in the queue specific to anything other than that. People are just really interested in knowing what to do with employees and employers. So, but I think I do want to start with one larger question, and Michael Lalonde, I think, asked it up here. So you just said, Michael, we all kind of heard the same announcement from the CDC the same day. So you and I probably heard it close to the same time. And in future, when we're looking at announcements that come from the CDC, hopefully if we keep progressing or as things change over time with this pandemic, what if you had a magic Osha wand and to wave with the CDC and the OHA, how do you think we can improve upon coordination of announcement to interpretation to guidelines? What are your thoughts on that?
So I think in a way there are two different, actually there are three questions there. One is the federal government coordinating with the states, and they've done that well on some issues. They didn't do it well at all on this issue. I also have the sense that within the federal government, there was no conversation between the CDC and my colleagues at the Federal Occupational Safety and Health Organization. So even within the federal level, I don't think that coordination happened. It did happen on the state level. Although I see the comment that talked about the fact that it was sort of announced on different days. As I said, our rule automatically updates to follow the OHA guidance. We knew what they were going to say. I saw drafts of it before it was issued, and I had my document drafted to basically lay out in parallel. But I had told business reps and labor reps that I would share it with them before I issued it. So it didn't come out right on the heels of the OHA guidance, because I actually shared that that document and ended up going with a shorter statement than we'd actually considered originally. And backing up to the governor felt she had to react to the CDC announcement. And so she put the framework on it. Some of the media simply reported that she said you don't have to wear masks, but she actually, in her recorded announcement, made it clear that verification would be expected. So in the Oregon standpoint, every communication along the way said that verification was going to be necessary. What the governor left unspoken was some of the details about what verification would look like. And those are the pieces that OHA filled in, and that frankly, we just end up saying we're following OHA and applying it in the workplace. I sort of think that on the state level, especially given that we had to scramble when, I started to hear press reports. I got an alert first thing Thursday morning. I think on the state level, we coordinated fairly well. I will tell you, there were state representatives who had conversations with the CDC on Wednesday who had no idea this was coming the next morning. So I try not to throw other government entities under the bus, but I'm willing to throw the CDC under the bus on this one. Their communication and their recognition of the broader implications that employers and business organizations and labor organizations were going to want to have thought about really was lacking. Probably in part because they weren't having the conversations with federal OSHA that I wish they had had.
Thanks. Well, hopefully we all learn as we go forward, because obviously it's not over yet, and I'm sure there'll be new announcements in the future. But I think a lot of folks agree it'd be great to have good coordination of announcements and just decision making between the two. It's just helpful. One less thing to worry about. If we could dig right into some of these questions. First of all, I want to mention to everyone, Madeline and Finn, if you wouldn't mind putting into the chat a link. Oregon Business and Industries, I believe next week, is holding a webinar with legal advice for folks in how to ask for vaccination verification, because I'm sure Michael is going to do his best to interpret all the guidelines. But for those of you really wanting to sit down and listen to a lawyer tell you about all this, I would suggest going to that link and signing up. It's free of charge. So from our friends at let's get going. So several questions around, can you develop a different protocol for vaccine checking, but mostly for masking between your customers and your employees? Can you have two different sets of requirements?
Absolutely. I think it's entirely possible. I know that I believe in the restaurant industry, there's an inclination to go toward relieving customers of the burden, but leaving the facial coverings on employees without vaccination status. I think the question was sort of asking the reverse of whether you can basically tell your customers that you're not going to mess with the verification, but when you have the time to engage with your employees and you have an ongoing relationship with them, can you essentially say employees don't have to be masked if they have, if you verify their vaccination, but customers do have to be masked? Yes, there's absolutely no, certainly from the OSHA standpoint, there's no issue with that. You may get pushback from customers about why the employees can, have more latitude than they do. But I think I'd actually, if I were in a public-facing business, I would seriously consider doing exactly that and just trying to explain it clearly on the signage that we don't want to have. We've allowed if you see an employee without a facial covering on, you can be assured that they have been vaccinated and that it's fully in effect. We're not able to do that with our customers, so we hope you'll understand and wear a facial covering for everyone's protection.
So I've spoken with a lot of employers, and many of them are in this chat right now, who have just stuck with the original recommendations, and all their employees, especially in food industry, are just wearing masks regardless. And there just seems to be such a broad ability to make your own decision based on whether or not your employees are vaccinated, and then the perception of your customer. So that seems to be, and what I have seen out there on the ground are people just making a personal decision, a company decision to go one way or the other. But there are a lot of folks in the queue here asking, and I apologize because this is going to be kind of a legal question about the HIPAA and whether it's a HIPAA violation to ask your employees or to ask your customers for validation of vaccination.
Well, I'm not an attorney, but it is absolutely not a HIPAA violation to ask either employees or customers for validation of vaccination. The simple cop-out way to say that is HIPAA applies to care providers with regard to their need to keep our medical records confidential. It actually does not apply to to providing it between two individuals. There are medical privacy issues to be aware of, and I certainly would discourage anyone from making any copies of materials the customer displays. We won't expect you to have them if we do enforcement, because there are medical privacy issues there. As far as medical privacy issue with regard to the inquiry for verification itself, I think the best way to look at this is that the individual, you have ideally signage that says you need to wear a facial covering in this establishment unless you are vaccinated. If someone walks into that establishment, they are declaring that they are vaccinated. When you ask them to provide verification of that, you're not asking for any more medical information than they've already given you, which is the fact of their vaccination. The only person for whom it's a problem is the person who wants to claim the vaccination exemption, but has not, in fact, been vaccinated.
Okay, thank you for that. I know it puts you in an uncomfortable position to answer legal questions, but it's really hard to extract one from the other. So another question in the queue, what do you think are the odds of these regulations going away, at least temporarily, if not permanently, sometime this summer? Or is the state planning for watching those numbers hitting the 70% and then, or 65% vaccination statewide, and then something will change from there? What do you see coming down the pike?
Well, there are multiple sets of sort of overlapping requirements. I know that the governor and the Oregon Health Authority have been clear that they expect the risk level metrics to go away when the state hits 70%, which they anticipate will be in June. And so all the capacity guidance, all the specific guidance about issues related to managing customer traffic will at that point go away. The rule itself, I would expect that we'll start having serious discussions about whether parts of it should be repealed early this summer. And so I actually just got out of a meeting with the Oregon Osha Partnership Committee, which is the standing committee that advises me. And they suggested, and I agreed, that rather than having meetings every other month, as the rule obligates us to, we should have meetings every month, because it does seem that there are pretty rapid developments going on. Now, 70% isn't a magic number with regard to herd immunity, and certainly 70% having had the first shot isn't a magic number with regard to herd immunity. And then one of the other things we'll have to look at as we sort of assess whether all the rules can be repealed is not only the state average, but local variation. I mean, if the way we get to, say, 80% statewide is that one large county has 95%, we have to think about protecting employees in those other locations as well. I think probably masking goes away sometime this summer. I think some of the provisions about the rule related to notification of employees if somebody else has COVID-19 and the medical removal the basic plans being in place. My prediction is that they'll stay in place longer. But 2 months ago, I would have told you that I thought the whole rule would be in place until at least September 1st. So it may happen faster than that. But certainly I think we've all gotten good news with regard to the effectiveness of the vaccines in relation to most of the variant strains. And we were all fearful that we wouldn't be getting relatively good news there. So that's worth remembering.
Thanks, Michael. So I'm watching a whole bunch of questions come in all around. How do you actually verify that somebody is vaccinated? There are questions about, do I laminate? Questions about, can I just show you a picture of it on my phone, which I've done. I don't know if anybody else has done out there. What's the responsibility of an employer or a business if somebody comes in with fake ID? Who knew this would happen? But how far do we go as employers and business owners in making sure that vaccine card is valid? And what methods can we use to check? You're on mute.
Yeah. You do such a good job of muting me that I forget that I have to unmute myself. So the first answer is I would not carry the actual card. I would carry a photograph of both sides of it on my phone. Partly because, there are parts of the state where if somebody might reach out and take the card out of your hand and tear it up. Frankly, there are probably those individuals in all of the state. So I would carry the future just in order to keep the original intact. As far as the potential for forgery is concerned, that's real. No doubt it will happen. We aren't going to expect employers to navigate that. I mean, if it's filled out in crayon, I suppose we might ask you to question it. Or if somebody says, as they hand it to you, yeah, I printed that up this morning and filled it in. Looks good, doesn't it? I mean, but as a general principle, if somebody provides you what looks to be a card showing the verification, or if they show you the verification of vaccination on the computer record. I mean, I went to the state fairgrounds, so even though I don't normally work with Salem Health, I have a Salem Health record on my phone that shows I'm vaccinated. If you accept any of those, that's going to be sufficient verification, and you really don't need to dig into the question of whether it's fraudulent.
Okay. Thank you for that clarification. Couple of questions in the queue about people who are working in retirement communities. Is there a separate guideline for them as far as visitors and residents? You're still muted, sorry.
I believe that there are separate guidelines established by OHA, and I think DHS is part of those as well. We actually haven't dug into those for the most part. Even when we've had complaints about those settings, we generally have ended up addressing them through a phone fax inquiry, and our jurisdiction doesn't run to protection of the residents there. So I believe there is guidance. I think you can access it on the OHA site, but I'm not familiar enough with it to speak to it. In spite of those people who think I will speak about anything, anytime, I do occasionally recognize my limitations.
So the next question is around how will OSHA enforce these new guidelines? We've seen in Bend and Central Oregon and other places around the state where it's been very public or not so public, OSHA coming in and enforcing the original guidelines. This one seems a bit more squirrely and more difficult to track down and enforce. What are your thoughts on that? Unmute. Unmute.
That's really just a stall context so that I have more time to think of my answer. You're certainly right that some of the most visible cases have been really straightforward, a flat out refusal on the part of a business who's also an employer. We've done a lot of other enforcement inquiries, and we've handled a whole lot of complaints. We've handled something now in the neighborhood of 25,000 complaints related to COVID-19, and we've done 300 or 400 inspections. So the first thing is, it will probably be handled with an inquiry and a discussion if we get a complaint about an establishment. Even where we've gone out and done inspections and we've identified violations, the typical penalty for a violation related to COVID-19 has been $100, $125, or $175. Now, the ones that get publicity and visibility are willful violations. You're not going to be cited for willful violation unless you are flat out refusing to comply. So an employer who's making a genuine effort, even if it's an insufficient effort, an employer who's making a genuine effort to verify the vaccinations certainly doesn't risk serious penalties. And really, if they're making a serious effort, they don't risk any penalties at all because there won't be a violation. It's more along the lines of dealing with the situations where grocery stores expect customers and employees to be wearing facial coverings, and we get complaints saying, I saw 3 people's noses at XYZ grocery store yesterday. That's not a systemic issue that's isolated. And we, even if we verify that that happens, and sometimes we have verified that it happens, that isn't going to result in a citation unless it's a systemic problem. The same thing would be true with verifying vaccinations.
Okay. Not quite sure what this question means, but why did OSHA not establish repealing metrics prior to making these rules permanent? I'm not sure what metrics you were talking about, but
I think the idea there is say it reaches 80% vaccination and the infection rate is at a certain level and the test positivity rate is a certain level. And I did touch on that in my initial comments, and that's where I was talking about it's complicated. And I don't mean it's too complicated for you to understand. It's too complicated for me to understand. There is a complex algorithm of those factors, and we don't know exactly how they'll relate to one another. We're still learning things about breakthrough. We're still learning things about the effectiveness of the vaccines in dealing with variants. We're still learning things about the degree of variant spread. So while we know all the factors, really all the criteria we'll consider, we don't know the algorithm that puts them all together and spits out a yes/no answer. And actually, when you look at the previous year, we've seen that even in somewhat simpler situations, every time we've developed metrics, we've ended up struggling, we being the state, OSHA hasn't been, but we've ended up struggling with their application in certain situations. And so, if I could have identified a yes/no threshold that would just be automatically triggered, I would have been happy to do that. The reason we didn't do it is I couldn't answer the question.
okay. Several questions in the queue, Michael, about how you verify and questions around, can you take somebody's word for it, or do you need visual verification of some sort of vaccination card? Sorry, you're on mute again.
There you go. Based on the guidance that the Oregon Health Authority has issued and the position that Oregon is taking, you have to have some sort of visual verification. You can't simply take people at their word.
Okay. So lots of curiosity around, do a lot of businesses set up greeters and all sorts of things, making sure people were walking in restaurants in one direction to the bathroom and that they weren't starting. I mean, it was just ridiculous what we have all lived through the last year. But there's still questions in this queue about So what is the flexibility of checking somebody's vaccination? Can you do it are you forced to do it outside before somebody comes into your establishment? Can you set it up inside? It's an additional expense if there's one person checking everybody's ID as they come in if they're not wearing a mask. Tell me a little bit about what your recommendations are there.
So whoever's managing the mute that time sent me the reminder before I failed to honor it. You don't have to check outside. You certainly can check in the establishment. I think most establishments have been dealing with that with regard to masks now, that if somebody steps in the door without a mask, you engage with them about the need to put one on and offer them one. That all, in most places, pretty much happens within the establishment. And I would anticipate that the conversation about vaccination happens within the establishment as well. If you have a method of greeting people at the door, either because it's a small establishment, so you can generally greet people as they enter in any case, or you can greet them very shortly after they enter, then you can just apply that. If you set up some sort of greeter for other reasons, or you've been using a greeter with facial coverings, it's fairly easy to expand that. If you've been operating with if you've been operating successfully with just signage, telling people they need to wear facial coverings, and then enforcing it by exception if you see people in the place without facial coverings, I think I'd be inclined to just leave it that way, rather than to try to station somebody at the door if you don't have them there already.
Thanks. That's really helpful, actually, because I know there are a lot of businesses struggling with exactly. It is just uncomfortable. It's like worse than asking somebody for their ID in a bar. It's tough because it's so emotional and difficult, and so many different personalities and belief systems out there. One of the things, I'm just going to make a macro statement here, that I know that you heard testimony on yesterday too, was the business community is incredibly uncomfortable having to be the enforcers of checking ID for something, for anything other than, are you 21? This is new for everyone. There have been some really nasty confrontations out there, and just people with very different worldviews. So how far is the question, do businesses go when you are feeling either threatened, or you don't want to cheese off your very best customer who drops a whole bunch of money in your store but refuses to wear a mask? And you see the difficulty here. What advice, what observations can you give to businesses who are put in this uncomfortable position?
Well, the two examples you gave are probably two different responses. So if you have somebody who's potentially volatile, I would advise them that they can't be in the store without a mask unless they're wearing a facial covering. If they insist on, they can't be in without a mask unless they provide verification. If they insist on remaining and refuse to provide verification, I would withdraw from the encounter and I would call law enforcement. Now, how quickly law enforcement get there is going to vary in situations, but you're dealing with a trespass situation. If you're dealing with overt threat, then I definitely call law enforcement, but I wouldn't challenge the person beyond that with regard to the threat. At that point, you need to, the risk isn't potential. At that point, the risk is very real, and it overrides the concern about having somebody in the establishment without a facial covering on. I realize that can be a little bit of a hard balance to strike, but frankly, we're going to incline to take it seriously as long as you don't do it routinely. I mean, if everybody who comes in you decide is potentially threatening, and so you're not going to talk to them about it, and you forget to call the police to tell them they have to leave, that's obviously a different situation. The problem with the customer is tougher because that doesn't give them a different set of rules. And I think you need to engage with them. And frankly, with them, I would weigh very heavily into blaming me. The one thing we do give you by saying clearly that you have to verify is you can tell that customer, you know, it's not up to me, it's what the state requires me to do.
Right. Which is really what we've all been doing all along. So let's go back to employees and the folks that you work with. Several questions around how private is the information among your team? Do you keep a list of who's vaccinated and who's not? I'm assuming you can as an employer, but do you keep it to yourself? If employees ask who here has not been vaccinated, is that something you can or can't share? And what if you're at 65, 70% of vaccinated people in your actual office? Are you still allowed to go without masks? If you hit that threshold, when you're all in, let's say a lawyer's office or maybe that's a bad example, or I don't know, bookkeeping or whatever, real estate, whatever it happens to be. Let's say that you reach 65 to 70% of your employees are vaccinated and the rest aren't. What do you do? Can everybody not wear a mask?
No. The exemption with regard to vaccination is an individual exemption. So it frees them from the requirement to wear a mask. So until you reach the point where you're talking about 100%, then it really doesn't become generally applicable. The 65% and the 70% are metrics designed to be a bit of a proxy for community spread risk. And so that allows OHA to say, we think community spread is less likely, and therefore we can back off those requirements. But it doesn't work to do it in the context of individuals. There were two parts to your question, I think, and I've forgotten
The other
first
part was, how private is this information?
Oh, the private, yes. So strictly speaking, I would not tell other people who is vaccinated. However, if they know that you are verifying, then they're going to know that the people without facial coverings are not vaccinated, or excuse me, are vaccinated and have chosen to share that with you. But even I wouldn't confirm that. That's a little bit the, you know, when your employee calls you and tells the receptionist, I have terminal cancer, this is terrible, and then calls you and says, I have terminal cancer, this is terrible, and the receptionist comes and says, is it really true she's got terminal cancer? Strictly speaking, your answer at that point is supposed to be, I can't talk to you about that because you have medical information about your employees. And that would be true here as well, even though the inference about who's vaccinated is going to be fairly easy.
Yes. So just going to reiterate it, just get it through my brain. If you work in an office with people that really would like to work without a mask, you still have to achieve 100% in that office to unmask everybody?
Yeah, realistically, if you receive 100% minus one individual, it's unlikely we'd issue a citation. If everybody is vaccinated except one person, and particularly if there is actually a reason that that person is not vaccinated, I think at that point we would probably, we'd view that as a de minimis violation. But short of that, if you got multiple individuals in the workspace who are not vaccinated, you need to make sure that they continue to wear facial coverings.
Dang it. Okay. What if somebody had COVID and recuperated? Do they qualify as vaccinated because they have the antibodies, or you actually have to have the vaccine? If you're in your workplace and let's say there's 20 of you and 2 people have experienced COVID and recovered, and they want to come back and everybody else has been vaccinated. I know this scenario, but they have not. Does that qualify because they have the antibodies, or do they need to also get vaccinated?
Based on our current understanding of the science and our confidence in the science, both the CDC and OHA say that this applies to individuals who are vaccinated, not individuals who have previously had the disease, and certainly not individuals who've had a mild previous case of the disease.
Okay. Let's see. Lots of follow-up questions. We could go a long ways talking about how do you share this? Who keeps it? Questions about if you're a larger organization, you have an HR person, should that be where all this information is kept rather than by individual managers or somebody else in your company? I would imagine you go back to what, your regular protocol for anything else HR related?
Yeah, I think that's right. When you're dealing with sensitive information in your HR files, certainly the written records, I think you would have maintained by HR. I do think that individual supervisors and managers need to have access to the simple yes/no question. Can this individual go without a mask or not? Because they're the ones who are going to have to ensure that that is followed in the workplace. And so I wouldn't say that they can't be told essentially who's vaccinated or who's confirmed their vaccination is really a more accurate description. But I wouldn't give them the list itself, or if it's fairly complicated and you have to list it, there's probably in that situation where you have different managers at different times, a retail store, for example. I would handle it the same way you handle other sensitive information.
Okay. So a few questions of folks that have employees in really super close proximity. For example, if you are working in the field.
Katie, can I follow up real quickly on one question that I just happened to see in the box that relates to something that I just said, apparently not clearly? So the question is, was I saying that if everyone was not vaccinated, does everyone have to wear a mask? No. Individuals who are vaccinated do not have to wear a mask. You just can't let everybody be exempt based on the fact that 75% of them have been vaccinated.
So what does that mean to the folks who have not been vaccinated? Everybody else is running around without a mask. Then what do you do with the aren't vaccinated?
They are, based on the CDC guidance, they are fine. This is based on the reason this change came wasn't based on the effectiveness of the vaccination in preventing an individual from becoming ill. It was based on the fact that that there were earlier questions, but it has become clear that there is very little likelihood that a person who is vaccinated can have sufficient virus to infect others.
Got it. It's a good reminder. So again, going back to this question from one of the folks that are on the Q&A queue here, let's say you have a field crew that's been traveling around in trucks together with the windows down and their masks on for 1.5 years. What if, I'm assuming if they're vaccinated, just like you would be in an office, they don't have to wear a mask. If one's vaccinated, one's not, you're traveling to a job site in a truck, what do you do?
The strict answer is the one who is not should have a facial covering on. Whether that would actually generate a citation is probably a different question. I'm sure we will be busy with other things, but strictly speaking, that is what the guidance says.
Or you can stick your head out the window. I don't know. Okay. Let's see, just loads of questions around senior centers. I'm sure that, well, let me ask this, moving forward, I'm assuming that senior centers, everybody who comes, hopefully has been vaccinated in senior centers, or at least enough to create a situation that is safer for them. But if people come into a senior center, I'm assuming that's really where they're hardcore about checking temperatures, checking vaccination cards, etc. And do you see that as the way it's going to be for a while?
I think it's probably likely that in establishments like that, that there'll be more attention longer to these issues. Our jurisdiction is actually only in relation to the employees, and I know it's risk to the employees, so it does relate to people who come into contact with employees. That's how we get to the issue of customers in a public-facing business. But there are a lot of establishments that operate pretty passively too, where most of the people in it at any given time actually aren't employees, or sometimes even all the people in it. Our issue is, are the employees protected? Now, OHA and other regulators may have broader concerns than that, but that's what we look at from the Oregon OSHA standpoint.
Okay. Some folks want to know, they have protocol in place where they're checking their employees regularly, either getting COVID tests or checking their temperature, or whatever the protocol is that particular type of business is adopted. Has any of that changed if, and I'm assuming if you have reached 3/4 of the folks, what do? If you're not at 100% vaccination, you're going to check that at least once. And then I'm assuming you don't need to do all the checks of temperature and COVID positive. Does that all go away? If, let's just go with one scenario, 100% of your folks in this, make it up, healthcare center are vaccinated. Do you have to check the regular checkpoints that you've been doing every day after they've all been vaccinated?
So many of those checkpoints aren't our requirements now. Temperature checks, for example. There are certain establishments that required from a public health standpoint. We did not establish a general temperature check. There are real issues around the reliability of using temperature checks as your primary screening tool. You use the example of a healthcare setting, that becomes a little more complicated, but a manufacturer, certainly if they've been doing that sort of screening, they never had to, and they don't have to continue it absolutely in the face. And in fact, I think it would be probably largely wasted effort in the face of a high vaccination rate. What you do still need to be aware of is, if somebody does become sick, you still need to do the notifications. You can't say, I'm not going to notify those employees because, hey, they're vaccinated anyway.
All right, one last question before we have to sign off, and it is around contractors and customers that you see every day. I'm assuming if they show you their ID, that you're good to go. Okay.
Absolutely. This is not like the situation where you have to check the ID on the person who bought a drink from you yesterday and was legal, and you still need to look at them again. If you have verified that individual's vaccination, and you know that you have verified that individual's vaccination, you do not have to do it again. Right.
And just reiterating here, we're talking about people who aren't wearing masks.
Absolutely. If they're wearing a mask, you don't have to worry about it at all. That's why I really don't describe it as a requirement to verify vaccination. It is a masking exemption that if they take advantage of it, requires that the vaccination be verified. And that may sound like splitting hairs, but it really is a significant difference. Katie, I know there are a lot of other folks who had questions, some of them very specific questions that we were able to get to. If you roll them into a written document and send them to me, we'll get responses back to you that you can share however you like.
That would be great. We'd be happy to do that. I really appreciate it. So many questions that were asked today. I did my level best to get to them and bunch them together in ways that made sense to ask the questions. So we will take a look at these and put them in a document and get them to you, Michael. I want to thank you again for being here today and answering all of these questions and trying to give us some clarity. Uncomfortable position for a lot of folks, but the good news is hopefully this is all going in the right direction. So thank you again for your time today. Thank you again to Miller Lumber and SunWest Builders. Also, next week, for those of you interested in joining us again, our webinar on the 25th will be on workforce housing. That is attainable housing for people who actually want to live and work in Central Oregon and Bend specifically. So please join us for that if you're able. I want to thank all of you for coming today. Be safe out there.